Once again, this is Liz Brune at the Corridor Group, and our webinar today is titled Oasis Assessments Through Observation Rather Than Interview. Now I'd like to introduce our speaker for today's call. Laura has more than 30 years experience of senior level healthcare management experience, developing a number of new programs and providing a variety of services and programs to clients with the result of positive outcomes. These services included integrated healthcare services designed to mesh with the operating entity's mission and goals. At times, these programs were the first of its kind in a region, necessitating education of many levels of professionals and community organizations, as well as people who would refer people to the program for care. Laura's main focus is on organizational structure, staff needed to succeed, key indicator development, project management, financial analysis, and profitability. Laura's extensive experience in the healthcare field includes executive management, program development, educational programs, strategic positioning, and operational and strategic planning for companies. She has expertise in operational processes, program applications for regulatory approval, team building, startup organizations, policy and process development, and flow. She specializes in strategic planning and analysis of operational processes to build impressive financial results. With that, I'm happy to turn things over to Laura.
Well, thank you very much, Liz, for that wonderful introduction. And let me just get my technology in order here. Okay, good. All right. Well, hello, everybody. As Liz introduced me, I'm Laura. I have been in home care for a very long period of time, and it's my pleasure today to have this webinar with you. I'll be talking about Oasis assessment through observation rather than interview. And the reason that this is a subject very close to me is that in the 90s, when Oasis was first piloted, the agency that I was running at the time was one of the pilot agencies. So I have seen the Oasis from its inception to this point in time. And I would say that after all of the Oasises that I personally have done and have had my staff do and have taught staff to do, assessment through observation rather than interview really does give, I believe, the most accurate assessment, which will give the most accurate data. That being said, I'll start to go through. The objectives today are that we understand the importance of accurate reporting of Oasis items. I have sat on committees at the CMS level, and I have often thought, after reviewing so many Oasises, of the data set that we have given to Medicare and Medicaid through our state. And I really do believe that the data that we are giving does not accurately represent the acuity of our patient caseload that we see and take care of and make better. I think that we do ourselves at times a disservice because we really do wonderful things, and it has to be captured, and this is how bureaucracies capture data. So the accurate reporting of Oasis items is critical, very critical on many different levels. We want to discuss the strategy that we utilize in the observation mode to assess our Oasis items and to come up with the most correct answer for that particular patient on that particular day. I want to have people understand the significance of observation versus interviewing a patient, and to look at the effects of that strategy of the observation. We want to look at the importance of other documentation, too, that supports the Oasis items. I am sure all of you can relate to the charts that you may have read over the course of time, and you look at your Oasis answers, and then you look at other either assessments or other pieces of documentation that go along with your Oasis, because it is not an entire package, the Oasis questions in and of themselves. And certainly sometimes that documentation does not come together, and in some cases I find that I feel like I'm reading about two different people. So again, we want to make sure that every document that we have actually gives a story to someone who's looking at the documentation. And we want to I want to talk a little bit about how completing the Oasis assessment really impacts your regulatory scrutiny. In this day when so much of our documentation is looked at by Medicare and other regulators, we want to make sure that our documentation is robust and stands up to any regulatory review. So, of course, Oasis stands for Outcome and Assessment Information Set, and it is really, I define it as the home care tool to accurate data collection and enhanced patient outcomes. The tool was developed by the University of Colorado. It was started to be used in 1997 on a pilot basis, and then it was required to be completed at the initial start of care at every certification period, which is 60 days, after a person is hospitalized, and if a patient is discharged or transferred to a facility. And these are called Oasis time points. The SOC or the ROC or the transfer or the discharge is commonly referred to as Oasis points in time. What is the Oasis? Now, I actually found this in the old days. We used to call CMS HCFA, the Department of Health and Human Services and the Healthcare Financing Administration. And in 1999, they wrote about the Oasis on page 32,993, which shows you how many pages they had. But Oasis is not an interaction or a survey. This is Health and Human Services definition. It's part of an assessment of the patient. It's conducted by a registered nurse or therapist. The home health agencies already do an assessment of each patient's physical and emotional conditions, but what they wanted us to do, they wanted us to see the comprehensive assessment for the type of care that a person might need for that particular episode in time, and they wanted us to report a portion of that assessment to the Healthcare Financing Administration, we now know it as CMS, so that CMS can perform several critical functions such as calculating the appropriate amount of the government to pay for home health services, or to ensure that home health agencies are providing the highest quality of care for the entire agency and for each individual patient. So basically the Oasis was really set to do multiple things within a document. So it's part of the condition of participation that a comprehensive assessment be performed for all Medicare patients and now all Medicaid patients. And you need to have these filled at points in time, and the data is exported to a repository. Every piece of data entered on an Oasis is captured in software of varying types, and people do have to enter the Oasis. Even if you are on paper, you have to enter the Oasis into a software. And once it's locked, once your errors are corrected or you validate your Oasis, it can be locked, and then it is sent to the repository. The data is analyzed in many ways. We call it slicing and dicing the data. It's put into various modalities. Home Care Compare is one that collects all of this data, analyzes it, and then puts it into a format that both agencies and consumers can understand. But a purpose of the Oasis data set from the beginning was that they wanted to see the acuity of the patient who receives home care. And we know that we have acutely ill patients at home. We also have patients who are discharged early from a hospital, and certainly after that event, certainly are not what I would consider well. They might be getting to another point on the wellness continuum, but they certainly are not there. And another purpose was to see the outcomes of the person who has received home care And would they be any different from people who did not receive home care? And again, it was to see the value of the home care services in the continuum of care. I think we have proved that over the course of time. Home care services become more and more and more important over the continuum of care. They're value added, they're cost effective, and I believe that they give the service to the patient in the place the patient wants to be, and that's their home. They feel more comfortable there, and I think people get better faster in their own home. However, we have a new word in our lexicon here in home care. It's called data mining. But by virtue of us giving this data and virtue of the technology moving forward, there is an ability, and CMS is picked up on this and is moving with this, to data mine the data that we present to them. We want to see, or CMS wants to see, if there are flaws in the data. In other words, does A equal B equal C? And unfortunately, if we do not fill out this Oasis accurately, A might not equal B and might not equal C. So again, very important to collect the data accurately. If there's inconsistency in the data, the patient is functionally independent on the Oasis, and the bill comes in with home health aid services. Or again, the patient is functionally independent in the ADL portion, and yet physical therapy makes 15 visits. This is data mining. The inconsistency is picked up in the machine, and CMS wants to evaluate that further. Again, also the data gives very important variables to the Medicare program and to CMS as a whole, also to Medicaid. Again, gender is one, age, the support systems. But what these data variables help CMS do is make informed decisions that are evidence-based and data-based about home care services, so the regulators can act. Now, assessment data communicates on the Oasis, of course, demographic data, diagnostic data, activity, ADL and IADL data initially and over time, because it is points in time along the spectrum. It does collect caregiver data, and it does collect hospitalization and nursing home data and outcomes of patients initially and over time who receive services from your agency. So there is a lot of data within these specific bullet points. So the objectives of Oasis really is to document a description of the patient on a comprehensive assessment or reassessment, if you're recertifying them, that accurately reflects his or her condition, abilities, and environmental situation at that point in time. It does provide assessment data that supports the plan of care that is developed by the clinician. It does accurately describe the patient outcomes, and it does reflect clinical competence. The objectives, again, it provides an accurate database, and it does provide a story of relevant patient information that defines the patient's health status over the course of time. So if I am reviewing Oases and I can take 4 Oases and put them side by side and look at the questions in a time frame, side by side over 60 days, 120 days, 180 days, I can see how that patient actually progresses, remains stable, or declines. However, if the data is inaccurately captured within the Oasis, then I might not have a clear picture of any of those points. It does prompt care coordination for effective care planning by virtue of doing the Oasis and the other tools. You can effectively develop a plan of care and know what coordination needs to occur to make that plan of care move forward and progress to the goals you've set for that person. Oasis really does justify the plan of care. A correct and accurately collected Oasis, the data, it will justify the plan of care. It will also point up when the plan of care cannot be justified to a reviewer. So very important, again, to collect accurate data. It does provide patient outcomes to the insurers at a proscribed point in time, and insurers, if they utilize the Oasis or it is available to them, they will also look to see what the outcomes of the patients are like after a certain amount of visits are done.